Welcome to the third virtual listening session held by members of the Board of County Commissioners. I'm Dylan Blaylock with Clackamas County's Public and Government Affairs Department, and I'll be coordinating the public comments for today's meeting. If any attendees would like to provide a comment, you'll be prompted to do so in a few minutes by me by utilizing your raise hand feature on Zoom. The raise hand button is on the Zoom bar that's at the top or bottom, depending on your device. You can also hit *9 if you're calling on the telephone. I can see that we do have at least 3 phone call-in listeners right now, so if you want to raise your hand, you can hit *9. Today's topic is the county's response to COVID-19, the coronavirus pandemic. Upon learning that the coronavirus was present within Clackamas County, we immediately activated our Emergency Operations Center to coordinate response. But what could Clackamas County be doing better than it is now in responding to the pandemic? What can commissioners and/or county staff be doing that will be better to prepare our community for recovery? And joining us today, we have Clackamas County Chair Jim Bernard, Clackamas County Administrator Gary Schmidt, and Emergency Operations Center Commander Nancy Bush, who is also the head of our Disaster Management Department. Today's listening session will go until 3 o'clock or until we run out of comments or things that individuals want to pass on to our guests, whichever comes first. The session will be archived to YouTube probably by the end of the day, maybe by end of day tomorrow. And with that, I'm going to go ahead and pass it over to Chair Jim Bernard to give opening comments. Chair Bernard.
Hi, this is Jim Bernard, your county chair. We are here to listen, so please feel free to tell us what you're thinking. I want to thank you all for joining us today during this ongoing time of coronavirus pandemic and its overwhelming effect on our way of life. The Board of County Commissioners have prioritized staying directly connected with our residents and stakeholders. Last week, we held our first 2 virtual listening sessions. We saw a lot of public participation. Clackamas County Commissioners are doing this to stay as connected as possible with our residents and customers during the COVID-19 pandemic. Today's topic is the county's overall COVID-19 response. Upon learning that the coronavirus was presented within Clackamas County, we immediately activated our Emergency Operations Center to coordinate responses. The Board of County Commissioners has taken ongoing essential action that guide this response. But we need to know, what would Clackamas County be doing better than it is now in responding to the pandemic? What are commissioners and or county staff doing that will better prepare our community for recovery? The point of today's conversation is for myself, County Administrator Gary Schmidt, Emergency Operations Center Commander Nancy Bush, to hear directly from you all your opinions and experiences during this pandemic and thoughts of how we can make it better. We're then going to take what we hear to the full Board of County Commissioners as we take action to help our community. We're going to try to get through as many comments as possible, but we may respond to some. Please don't perceive a lack of response from us as uncaring. We do care. We're just trying to hear from as many people as possible. And with that, I'd like to pass it on to our outstanding Clackamas County Administrator, Gary Schmidt.
Thank you, Chair Bernard. I appreciate that. Hi, everyone. I'm Gary Schmidt, County Administrator. So if you don't know, I am one of the County Commissioners' 2 employees. The other is the County Council, and I'm hired by the Board of County Commissioners to help implement their policy direction and support all the staff at Clackamas County in implementing and supporting the Board of County Commissioners' policy decisions. As Chair Bernard said, on March 2nd, Clackamas County did declare a state of emergency over COVID-19. We were the first county in the entire state of Oregon, and I believe the first local government in Oregon to do so. And since then, we have done many things to help protect the public, protect our employees, while ensuring that we continue to serve the public through our activities. On March 18th, the Board of County Commissioners decided to temporarily close most county buildings to the public so that we could protect the health of our employees and the health of the public, while we, again, still maintain our services to the public, yet we are primarily doing that remotely through email, through phone calls, through Zoom meetings like we're doing today. This closure of county buildings is in effect currently until Monday, April 20th, but may be extended by the Board of County Commissioners. So more to come on that. But we are still serving the public, as I mentioned. We're just finding different ways to do that. Our Board of County Commissioners are still meeting through these listening sessions, their Tuesday work sessions, their Thursday board meetings, all online, still accessible to the public, and your input is always welcome. Our Board of County Commissioners has updated their emergency declaration twice and are currently reviewing plans to update it a third time to continue to add items to that plan, all with the goals of ensuring that we are serving the public to the best of our abilities. So that's the comments I'll start with today. Look forward to your questions and hear how you feel we could do even better to serve you, the public, and our staff and employees here at the county. Next, I'll invite Nancy Bush, who is a department director at Clackamas County. She's director of disaster management, and also during this emergency is serving as the incident commander for our emergency operations center. Nancy, please go ahead.
Thank you, Gary. Welcome, everyone. So as Gary said, I am the Disaster Management Director here for Clackamas County, which means that we do all of the planning, exercises, or anything around all hazard disasters for the entire population of Clackamas County. So as has been indicated, as soon as we had a positive here in the county, we did have an emergency declaration that was done immediately. So just to kind of let you know what we're doing here, I'm going to first start out with some of the numbers that we have here in Clackamas County and in the state, just to give you some background of what is going on right now. So for the state, there is 1,132 positives. Clackamas County has 90 of those. There are 29 deaths in the state, and Clackamas County has 3 of those. The negative test in the statewide is 20,669. And Clackamas County has 1,870. So to let you know what the Emergency Operations Center does, we are a coordination center and we coordinate throughout the county all of the county response, as well as we work very closely with our cities and our districts, our special districts that are here in the county as well. We have been receiving personal protective equipment, or PPE, from the state, and over the past 2 days, or 3 or 4 days, I'm sorry, we have gotten at least 3 or 4 shipments. Some of those shipments have been smaller and some of them have been quite large. We check each shipment to make sure that it is viable, and then we work to get that out to the front lines, which is our EMS community and other healthcare providers here in Clackamas County. We have liaisons here in the Emergency Operations Center that works with our diverse groups, including non-English speaking or migrant workers and other groups that may need some special attention to make sure that they're getting all of the messaging that we are sending out from here in the Emergency Operations Center. We also have a community care initiative that includes putting together food boxes and getting all of those deliveries out to those that are in need. Food security has been a large issue because we have a lot of people who can't go out. We have some of the food pantries that have closed because they can't staff them. So we're trying to make sure people are safe and can stay at home and still receive food. We do all of the coordination for public information that goes out, and we also do coordinating with the Tri-County area to make sure that we're all sending out the same messages so that the entire region receives all of the messages and we don't have a lot of confusion there. So that is my brief update. Thank you.
All right, thanks to the 3 of you for joining, and thanks for those opening comments. So I see we've got nearly 80 attendees and the numbers keep going up, which is great. Thank you for joining us today. And we're going to get started now with public comment or any questions or comments or experiences you would like to relay to our 3 guests, or suggestions about how the county can go ahead and make things better. To go ahead and do that, please utilize the raise hand feature that you have on Zoom. That's going to be in the Zoom bar near the top or the bottom of your screen, depending on your device. And again, for individuals who are calling on the phone, I can see we've got 11 phone call-in listeners. You can hit *9, and that indicates to me that you have a comment to make. So again, hit the raise hand feature on Zoom. First up is going to be Lily, I'm going to say Kuchel. I'm not sure how to say it, but we'll say maybe it's Kuchel.
That is okay. I am trying to just become like Cher, where I only have one name. Thank you so much, commissioners and everybody from the Emergency Communications Center for being here. We really appreciate that you guys are taking the time out of your day, and I'm sure it's very busy. So my name is Lily Keithley. I'm the Prevention and Policy Coordinator for Vibrant Future Coalition, which is a Youth Substance Abuse Prevention Coalition that serves North Clackamas as part of Northwest Family Services. And I'm calling today to draw attention to some of the populations we serve. As you probably know, we do quite a bit with vulnerable populations. We operate a food bank, a women's shelter for Latinx women. We provide substance abuse prevention treatment. We support the recovery community. We do quite a bit, and we basically just need help. We need support for the food bank and the women's shelter. We need funding for naloxone to make sure people aren't dying of overdoses. And all these programs are really, really important to the communities that we work with. So bravo to you guys for trying to provide as much information in other languages as you can, and we would encourage you to keep on doing that. And we would also love some PPE, masks, and that sort of stuff if there's any available for community organizations. But once again, thank you guys so much. We really appreciate everything you're doing, and hope you have a great day.
Thank you. Hey, can I ask a question of Nancy?
Yes.
So I assume that she's called the Emergency Operations Center. If not, is there a phone number?
So I'm not sure if she has, but you can call. Actually, if you send an email, if you can send that to EOC command, which is all one word, at clackamas.us. We will be able to get you the information that you need.
Okay. All right, excellent. Thank you very much for the call, Lily. The next person up is going to be, I think it's Michelle Vinker. Michelle Vinker. So, Michelle, are you there?
I am. Can you hear me?
Okay. Yes.
Yep.
Go right ahead.
Hi. So I'm Michelle Vinker from NAMI Clackamas. I think I know most of you anyway. I guess what I am concerned about is, and what you said is part of the topic, is the future, what's going to happen. Right now, we are lucky that between grants from the county and SAMHSA and some other funding resources, we're okay to keep on doing what we do well. We've been able to do things remotely. We also have a nice, for the size of our organization, a nice reserve fund, but we know that some of those things that are vital to our remaining in business, funding for our fundraisers, the NAMI walk that's going virtual, and we're sure will probably not hit the levels that we expected before, our gala that's coming up, the things that pay for all those things that funders don't want to, including fundraising and admin and all that kind of stuff, coming up in the next 6+ months. Are you guys looking towards how you're going to be helping the nonprofits and others that you support in the more distant future, when we expect some of the results of this, including increases in mental health problems, increases in suicides and those kinds of things, hit maybe a little stronger than now, where we're looking at it's almost the calm before the storm, as people are just learning to dig in and hold on.
Nancy, did you, there is a nonprofit organization that is collecting funds or distributing funds to nonprofits. Do you know the name of that?
Yeah, it is the Benevolent Fund through the Sheriff's Office, and you can go to the Sheriff's Office website or to the county's COVID website to get that information.
Okay.
Okay, great. Thank you very much, Michelle. Let me see if anybody else would like to go ahead and provide a comment or relay an experience or ask a question. Please, again, utilize the raise hand feature on Zoom. That's in the Zoom bar near the top or bottom of your Zoom app, depending on the device that you're in, the device that you're using, I'm sorry. Also, if you're on the phone, remember you can hit *9. *9 lets me know that you have a question and you would like to speak. So with that, we'll go to our next question. It is from Vivian Perry. Vivian, if you are there, I think you need to unmute yourself. There we go. And you are on.
Yes, hello, and I'm sorry I'm about 3 minutes late for the meeting, so I missed the overview, but I have a question. It's just pretty much residential in nature, but a lot of my friends want to get the dogs together to play. I have a 10-month-old Australian Shepherd dog who needs to work out, but I've heard through my insurance provider that the virus can live on dog fur, and if two dogs are slobbering all over each other for 45 to 50 minutes, we could be violating social distancing. And I just don't expect you to be experts on this, but what is your advisement for us on allowing our dogs to get near each other?
Nancy, you want to take that?
I think that is one of the questions that we'll have to get back to you on, because I am not an expert in that either, and I don't want to give advice that is not appropriate.
All I know is that on the news today and yesterday, there was a tiger that is infected. But as far as I know, that's the only animal in the world that has been infected. So the problem with getting dogs and people together is that your social distancing will be a challenge. And I don't know what dog park would be open right now.
Yeah, and also us as humans, we're usually petting our dogs, and that, I think, when you're talking about living on the fur, I think that that's the concern there. But again, I think we can get an answer back out after we have the session.
Thank you.
All right, very good. Again, we have some 85 attendees. Now would be a good time to go ahead and raise your hand for a comment if you would like to. That's the raise hand feature on Zoom, or if you're on the phone, please hit *9, and that will let me know. In the meantime, I will go ahead and pose one quick question to the chair, because I know we've gotten it just in general county email over the last week. Chair, if you could just answer the sort of generic question: why did the board decide to ask for and then impose the eviction moratorium? Just in a general view, why was that action taken by the board? That is one question we've been fielding a lot.
Well, I'm trying to remember. We have thousands of people just on the edge of homelessness. I forget the number, maybe 5,500. It could be a lot more than I can't remember. And that's from missing one paycheck. And we couldn't risk putting all those people out of their homes and on the streets. Having people on the street is much more expensive than having them in housing. And also the possibility of spreading the disease is much higher amongst homeless people, especially since they're often sharing whatever they're living in, or utensils and things like that. And, frankly, we just care. We know that housing is the most important thing we can provide people, and it's a matter of life and death in this situation. And frankly, it is all the time, but it's even worse now. So that's why we did the eviction moratorium. We also knew that the governor was considering it, and that we needed to be ahead on that curve, as we have been in many things. That's why we did it. And businesses, it's the same thing. And most business property owners, getting a new business in is probably more expensive than just waiting a few months and collecting back rent, which is also true with housing. The rent will be paid. It's not rent free, and we just have to wait a little longer to get our checks.
Excellent. Thank you so much for that. I should also add for all of our attendees that the Board of County Commissioners has a strategic plan for Women's Clackamas, which specifically calls out 5 strategic priorities, one of which is ensure safe, healthy, and secure communities, which is exactly what they have been focusing on during that time. So we're going to go to our next call. It is our next Zoom, rather. Carly Dirks, you are going to be up here. If you could unmute yourself, there you go, and you are on.
Hi, everyone. Thank you from the community for spending this time with us. I know a lot of people are scared and unsure, so it's great to see faces and know there are leaders out there working on this every day. Nancy, you had mentioned you're doing messaging for non-English speaking populations and food security boxes, and we've heard from a couple of community organizations. I was wondering if you could speak more to how you're ensuring vulnerable populations, not just homeless populations, but the broader definition of vulnerable populations, LGBTQ, domestic abuse, undocumented populations. What is the county doing to ensure those other portions of the definition of vulnerable populations are cared for and that we are ensuring they're getting resources?
Yeah, thank you, Carly, for that question. We actually here in the Emergency Operations Center, for those groups you just talked about and others, we have a liaison in place to help connect us directly to those groups. So they get direct information from the Emergency Operations Center. We also have, as part of our operations group, social services, and we work very closely with them as well. And we have people here in the EOC that have a lot of experience in working with those different and vulnerable populations. And we also are working closely with the hospitals too. So if they have someone that is being discharged that needs a place to go, whether if they need to be quarantined or if they're ill, but they're not ill enough to be in the hospital, but they have no place to go, we're working directly with the hospitals on that discharge to make sure that we can put them in some housing until it's safe for them to go home or to go back to their communities. So we hear you loud and clear. We know that that is an issue, and we are reaching out to serve those populations. You know, and we do understand, you know, the undocumented individuals. We serve the population. Their documentation is not a concern for us. We're here for their health and well-being, and are working with those communities to make sure that they know that as well. Thank you.
Great. Thank you so much for that, Carly. Again, if anybody would like to go ahead and make give a comment or ask a question, please utilize the raise hand feature on Zoom. I don't see any comments right now. If you are on the phone and you wish to go ahead and make a comment, you can hit *9. Gary, I'm going to throw one question to you because I know it came up in the chair's interview with local media earlier today, and we've fielded some questions about it recently. Why did the county choose to shut its public buildings and then go ahead to a telecommuting schedule for most of its employees?
Yes, the primary reason, of course, was to ensure and protect the safety of the public and our employees. And as Nancy said in her earlier statistics, and if you're following along, Clackamas County has one of the lowest cases of those infected with coronavirus right now. And I think that's because our county and our state is taking it very seriously to stay home and protect yourselves. And so our employees are just as important too. And that's why we've asked employees who can to stay home and work remotely. In fact, the only employees right now who are in a county building are those who are providing a critical service and can only perform their duty at physically a county location. Otherwise, we've asked those employees to work remotely from home. I do believe that we are still serving the public. as best as we ever have. We're just doing it in different ways. But that is why the Board of Commissioners made the decision to temporarily close our buildings to the public and ask most of our employees to work remotely from home to protect their safety, their health, as well as the health and safety of the public. But again, I'm very impressed and proud of our staff. They are doing phenomenal work regardless of where they're located. And I hope the public feels that we are still supporting and delivering the services you expect to you, the public, even though we're doing it in ways that we have not done before. But I quickly want to draw attention to our transportation and development staff. They have found a way in just a little under 2 weeks to entirely provide permitting services online, which other jurisdictions have taken 7, 8, 9 months to figure out how to do that. Our staff did it in 2 weeks. So we are still able to keep the business of the county operating, and we're doing it remotely.
Excellent. Well said. Thank you very much, Gary, for that. Let me see. I still do not have a hand up from the 83 participants. Nope, we got one, and it's from a familiar, well, it'll be a familiar face and a familiar voice, Russ Axelrod. Mayor Axelrod, if you want to go ahead and unmute yourself, and you are on.
Hi, yes, thank you. And thank you all for your time and for your service and the opportunity for the call. I'm very curious, perhaps probably towards Nancy Bush, maybe could address the question. As we're kind of looking ahead and understanding how we might come out of this crisis and approach things, we still have really no data or understanding on the extent of the virus, who may be out there, who might test positive. I've heard nothing. We've received no information whatsoever about plans for testing ahead and when testing capacity or capabilities and different types might be available. I guess my question is, can you share with us any information or kind of a timeline when we can maybe anticipate having that better understanding? And is that really being sort of pushed down from the state to the counties and then out, or how is that being addressed? Thank you.
Yeah, thank you for the question. So yeah, we are following OHA's guidance, Oregon Health Authority's guidance on testing and who should and should not be tested. There is more testing available, but it's primarily through the healthcare providers, private physicians, and they're able to send those to laboratories. So OHA is not doing all of the testing at this time. However, we don't have, and I know you've heard this before, we don't have enough tests right now to do a large population, to like do a drive-through testing. We're trying to make sure that we have the close contacts of people who, of a positive COVID. And we are also working with our frontline staff, which is law enforcement and fire. And if they need testing, to make sure that we can get them into testing as quickly as possible, so we can also protect that population who protects us. I do not have a timeline. Like I said, we're following OHA's lead on this, and we just don't have enough tests at this time to do it on a large scale.
All right, thank you very much, Mayor Axelrod, for that, and thank you, Nancy, for that as well. If there's any other questions or comments, please raise your hand now. You can do that again, the raise hand feature on Zoom, or if you're on the phone, hit *9. The next question will come from, just the handle is Bill. So Bill, if you are there, you can unmute yourself. There we go, and you are on. Oh, Bill, if you're there, we do not hear you. So it might be a microphone issue. Yes, we'll try. We'll try to mute you and then unmute you. Okay, Bill, are you there? Oh, Bill, I'm sorry. I don't think we can hear you. And we run into this problem occasionally. Okay, if there's anybody else, go ahead and hit *9 if you're on the phone, or raise your hand according to the Zoom app. Let me see if we don't get any more very soon, then perhaps we will go ahead and stop a little early. But Chair, I'm wondering if you can say a few words about what you did yesterday morning in terms of the putting together food boxes and where that was and what the end result of it and the point of it is.
It's hard to tell which day it is. It's 7-day-a-week experience. But yesterday we worked with the Sheriff's Department, myself, Commissioner Schrader, and Humberston, and we did food boxes, mostly to senior centers or food banks. I think I had 21, Martha had 21, and Ken had 21. He drove up to Estacada and Sandy. So we had tons of fruit and vegetables, and then canned food and dry foods. And we made the boxes, loaded them up, and delivered them. It was a great experience. It's hard work. I mentioned to somebody, I hadn't done that since I was in Boy Scouts. That was a couple years ago. Gary's still in. But anyway, it was a very, very enjoyable. You can also, we are doing food banks, food boxing all the time. And I think you can call our Emergency Operations Center and they can tell you when they're doing that. Or also the Sheriff's Department, they can tell you when you can help. I know we're getting lots of volunteers, and a lot of the food banks are closed because a lot of people working there are senior citizens and they don't want to expose themselves, which I don't blame them. So anything you can do to help, and certainly donate food.
Thank you very much for that. We do have a call, or we do have another comment. It is from someone whose name is Gary, not our Gary, a different Gary, unless our Gary is a magician. So Gary, can you go ahead? Yep, there we go.
Yes, it is not Gary Schmidt, actually. Yeah, Gary Marquis with NAMI Clackamas. I think you heard from Michelle a little earlier. So first of all, I wanted to mention, I was watching the news and saw the story about Windhorse Coffee down in Milwaukee. They are doing a great job of staying open and practicing social distancing. And they were using them as a model for how a retail operation perhaps should shepherd their customers through. So that was an interesting story. I can't remember which of the channels it was on, but that was our Windhorse Coffee down in beautiful downtown Milwaukee. And I also wanted to mention that NAMI has online support groups up and running, and I really encourage anybody that knows somebody, whether it's themselves or someone else, that needs some sort of support in this days of isolation and social distancing. The NAMICC.org, shameless promotion, website is the place to go. And there are lots of really good resources as well as support groups all over the place, and all accessible and open because they're online. And especially, I think it's important for our first responders and frontline folks. I've been reading so much, and my daughter back east is a nurse in a COVID unit, in fact, and they are really stressed to the max emotionally, physically, etc., and really can use the kind of emotional support that a lot of them can maybe find in a NAMI support group. We could also use more volunteers for facilitating online support groups, because we'd really like to do more for our first responders with maybe some specific support groups that have people with lived experience doing that kind of work, like nurses and EMTs, etc. So I'm just putting it out there to this whopping 80 some odd folks that are listening to this in the middle of the day with everything that's going on, and that's my shameless promotion plug. Great job, guys. I think you guys are really ahead of the curve. Living in Multnomah County, working in Clackamas County, I tend to see the differences, and really do appreciate what you guys are doing.
Thank you.
All right, thank you very much, Gary. Appreciate that. Okay, and we have another comment. I'm going to bring in Vivian Perry. Vivian, you are on.
Yeah, I had heard you guys mention that we have a low positive test results in the county, but we don't have facilities set up, and perhaps that's a hospital related thing, but what is your take on the fact that we don't have drive-through testing and we're not testing widely? We're only testing folks that have symptoms. Are we going to get drive-through testing facilities in place? Are the hospital systems working with you? And, how does that alter our perception of how well we're doing with the virus in the county?
That sounds like a Nancy one for me.
Yeah, thank you, Vivian. So to answer some of your questions, yes, we are working with the hospitals. We have calls with them at least twice a week. And just to also expand that a little bit too, we're not just testing people that have actual symptoms. We actually are also testing people who have close contacts, known contacts of a known COVID case. So it is a little bit broader. And no, we're not doing, the mass testing that you've seen in other countries. That is not being done here. And as far as I know, it's not being done anywhere in the state of Oregon because we have limited test kits. So, and yes, I mean, you're absolutely right. If we tested everyone, you would see widely, very different numbers. And I don't know what that would look like. I do know that we would see different numbers. And we do have people who, don't get very, extremely ill. I'm not a doctor, but I have been reading about that and been listening to our doctor here on staff. So yeah, I mean, I'm sorry, I don't have, the great answer for you of when we will see more testing being done here in the state. It really is dependent on test kits and what test kits we can get.
All right, thanks for that, and thanks again, Vivian. The next question is from someone's handle is Shelly Joe, maybe Shelly John, either Shelly Joe or Shelly John. So Shelly, you are on. Are you there?
I am. I didn't
Great.
even realize I had pushed it, but
Oh.
and I have a couple things. One, I'm with Aging and Disability Resource Connection here with the county, and people can also call us if they need a food box or any other resources, and that phone number is 503-650-5622. And we've changed our hours to be operational on Friday as well. And then Chair Bernard, I had a question about the eviction moratorium.
Mhm.
Will landlords be able to charge late fees for the rents that will be passed due? That's a question we're getting quite a bit.
If I remember right, so the governor came out with a eviction, no evictions also in businesses. I don't believe they can, but I'm not absolutely sure that they can charge late fees.
Okay, that
But
was the question.
The governor's eviction moratorium overrides ours.
Okay.
The one thing I'll add to this, Shelly and Chair, at the end of this session, within a few days, we always do put together a thorough FAQ that accompanies the archive of the session that summarizes all the questions and answers to those questions if we didn't go into them in detail. So I'd imagine that corresponding document, which will be on clackamas.us on the BCC page with the new listening sessions page, we will answer that in full as well. Next, I'm going to go to Cindy Dechen, maybe? Cindy Dechen, my apologies if I'm not saying your name right. There we go. Are you on, Cindy?
Yes, thank you, Dylan. Can you hear me?
Yes, go ahead.
Great. Cindy Dechen with North Clackamas School District, Community Relations. I wanted to put a plug in for the schools and all of the work that's happening behind the scenes, express some of our needs and our services. We are providing meals daily, as all school districts in the area are, for grab and go with drive-throughs at multiple school sites for breakfast and for lunch for any child ages 1 through 18. Those are done every day during the weekdays. We also have our Wichita Family Center, which is doing box pickups for food as well. We are running low on supplies, continue to look for some of these donors as well, and wondering how we might be able to coordinate those efforts. We're hearing about all these different places. There's probably a website that everybody could go to. I want to direct everybody to the right place to get that information. And then just share that our biggest need, we're launching over 4,000 Chromebook devices to homes this week via our transportation services. But we need Wi-Fi hotspots. We need broadband. We're trying to broadly advertised. Cast is one in our area that's doing a $0 for I believe 60 days, and then it's a $9.99 per month for low-income families. But we're finding a huge need in that area, and just wondering if you have any other resources or where we can direct our folks to.
I think that's a question we're going to have to get back to you to, unless Nancy, you have something you want to add. No?
No, I don't have a lot. We are aware of the need, especially for the hotspots. I do know some of the cities, incorporated cities, are putting in more hotspots, but you would have to check with your city website to see where they are.
I can just add that we are having a discussion about expanding county Wi-Fi service. We haven't made that decision yet. Actually, internet service, not Wi-Fi service, but that's something we've been looking at for a number of years. I think back in 2011, we got a grant from the federal government, and we're expanding that to places that don't have internet services. And we had that discussion today, and we'll hopefully make a decision next week. Thank you.
Right. Thank you very much for that, and thank you for that, Cindy. Again, if you have a comment to make or a question to ask, please utilize the raise hand feature on Zoom, and if you are on the phone, it is *9. Next, we're going to go to Mark Meek. I assume this is, of course, Representative Mark Meek. Mark, Representative Meek, if you can go ahead, and you are on now, if it's you. Yep.
Okay, thank you, Chair Bernard, for your work you're doing with these meetings and keeping our public up to date. Very welcome and appreciated. And I just wanted to let you know that we received your letters this morning, and I know that our public process and meeting, process is very important, and so it's duly noted. And if we're not able to get into a special session in the next few weeks, that I will advocate for the governor to make an executive order to allow our public business to continue. And so appreciate your continued work on that. And it is very important, because it's just the cities and the counties and everybody that's trying to keep our business going. It's gonna be very important to cross the finish line of this crisis with the ability to get our economy going again. And I'm a property manager and a rental property owner, and the governor's executive order does not allow for late penalties or fees. And you do have to, if they come to you, you have to work out payment arrangements. And there is currently, I believe, I'm not sure if it's in statute yet, but it would be a 6-month payback. But that's still difficult. We're actually, one of the things we're hoping to get together for the special session is to provide for some rental assistance to folks that are in need of that. We want to keep people housed, people safe, and keep our landlords able to make their payments too. So working on a lot of those details. But once again, it's my honor to work with you, and you can call me Mark Dillon. Okay. Thanks, guys.
Thank you.
All right, thank you, Mark. Appreciate that. Okay, next up we have Heidi Do. Heidi, if you can, there we go. If you can speak, you are on right now.
Hi, I have a question. So my mom is on Social Security, and she just received, her and everybody in her, she lives in an elderly apartment complex, and everybody in their building received a letter from the property management company that said it was just a reminder to them that if they received any new monies, that they were to make sure that they had to let the management company know so that they could adjust their rent accordingly. I assume that went out because of the bill that just got passed and everybody's going to get some kickbacks. Is that true? Like, can they take that, since my concern is it's not an ongoing check?
Yeah,
so I feel like they're being taken advantage of.
Yeah, I don't think we have an answer to that. It sounds pretty absurd. We'll see what we can find out.
Okay, very good. Yeah, we will see. And again, we will have an accompanying document of an FAQ when we archive this session in the next day or so. Okay, well, thanks for that, Heidi. And again, if anybody would like to provide a comment or speak, relay an experience, ask a question, please do so now. We still have 75 attendees with us. If you're on the phone, it is by hitting *9. And if you're just over Zoom, you can go ahead and just raise your hand. But aside from that, and not seeing any, I'm wondering if any of our guests would like to go ahead and add anything else to the conversation that we've been talking about, maybe a point you didn't make before.
Nancy?
Yeah, I do have something. I just want to be sure too, I give out our Public Inquiry Center number. That number is 503-742-5300. And you can call that number and ask some questions, and they will be able to either answer your question depending on what it is, or they can get you the resource that you need. And again, that number is 503-742-5300. Thank you.
Still clear?
It looks like we got one more hand. It looks like another question from Michelle Vinker. So let me go ahead and bring her over. Michelle, go right ahead.
And I don't have a question per se, but as we're talking about this, I thought that people might want to know that we're having the wonderful Mary Rumbaugh, who is the chair of the Behavioral Health for Clackamas County, talking tonight on a Zoom meeting about the state of the crisis services and behavioral health services in Clackamas County. So if anybody is interested in that, they can go to our website at namicc.org or email me at Michelle, M-I-C-H-E-L-E, at namicc.org, and hear how the county is working along those lines, where so many of their services used to be in person and now they're having to look at the social distancing. So we'd love to have people come and listen in if they'd like to.
Thank you.
Okay, great. Thanks very much. Thank you for that, Michelle. I do not see any more comments, so unless there is any final thoughts from our three, sorry,
well,
Chair.
Let me add something. I want you to know that usually 5 days a week, we meet in the morning over Zoom and have a strategy meeting, how to address the growing issues with the coronavirus. Also, up until this week, I was on the phone every night with the chairs of Multnomah and Washington County, trying to strategize how we can work better together. And I know Nancy is on the phone 2-3 times a day with various groups, and so is Gary. We are really doing some fantastic work together. I met with Ted Wheeler and the other 2 chairs. That's Catherine Harrington from Washington County, Deborah Kafori from Multnomah County. And we worked together to write that letter to the governor asking her to advise stay at home, stay safe. And as well as the eviction moratorium and a number of issues. You know, I got to tell you, I'm pretty proud of the work that Clackamas County's done, what our emergency operations done, what Gary and his folks are doing. We're working together, and while this is not over yet, we've got a ways to go. The biggest challenge ahead of us is what do we do when this is gone? How are we going to get the economy back roaring? How are we going to get our people back to work? You know, how are we going to get this homeless situation resolved? Because we cannot continue to do this. We have a responsibility in Clackamas County. We have goals to eliminate homelessness. And so we need your help. And thanks for calling and asking questions, and stay home and stay safe and wear a mask if you got them.
Yep, that's very good. Thank you very much for that, Chair Bernard. I do see, as you were speaking, we did get one more hand raised. So since we do have the time, I will go ahead and go to this person as well. It's someone on the phone. I don't have their name. I know their last 3 digits are 391. So if you're on the phone and 391 and you've raised your hand to ask a question, you can go ahead now.
Can you hear me now?
Yes.
Okay, yeah, that's great. This is Representative Jeff Reardon, and I just wanted to comment on how much I admire the work that the county has done, and being such a great partner with the state representatives that are in the area, knowing that we all share your concerns for not only getting through this crisis that we're in, but when we come out the other side, come out even better and stronger than we were. So Chair Bernard, the other commissioners, great partners, and thank you for all you're doing.
Thank you. Thank you for calling.
Thank you very much, Representative Reardon. That's going to be it for us today. I'd like to thank Chair Bernard, Administrator Schmidt, and Incident Commander Nancy Bush. I'm also going to try to share my screen real quickly. I think I'm doing that now. You can always go ahead and, can you see see my screen? Okay. You can always check our coronavirus page. That is also our alert page. As you can see, it's very extensive. We have staff in the EOC every day. We have had staff in the EOC every day since late February when this all started in our area. You can see the About section, updates, resources, closures, and please know that this is staffed all the time. So you can get great information there on a regular basis, and links to other reputable sites where we suggest that you get information, such as the Oregon Health Authority and the CDC. So for Clackamas County, I'm Dylan Blaylock. I'd like to thank everybody for joining us. We will see you. Oh, we have another Thursday. We have another Thursday session, a Thursday listening session on the intergovernmental response. We've had 2 state representatives call in thus far. That's going to be focused more on what collectively can not just Clackamas County be doing, but just as a region and through our partners and leveraging and that sort of thing. So again, thank you very much, and hopefully we'll see you Thursday.
Thank you. Bye-bye.